Good afternoon, everyone, and thank you for joining us for our last training for the first series of 2022. This is Marilyn talking, and I am filling in for Kylie today as she had a beautiful baby boy yesterday. So she will be on leave. So we congratulate her. So like I said, today is our last session for the first series, and then we will start up again in the fall. And usually we run them September, October, and November. But all of you who are registered will get notices long in advance, and you will not have to re-register. As long as you're registered for the first series, you'll automatically be registered for the second series at the end of the year. So recording today's session is going to be recorded. So there will be a YouTube link that I will send out as soon as I receive it, as soon as it gets converted. Certificates of participation, if you're needing one, again, just send me an email requesting one. Do not put your name in the chat box like we initially asked you to do. Just send me a quick email requesting a certificate and I'll get that out to you. So I think we're ready to go. Today's presentation is on coping with stress, which we can probably all use a tip or two. And it's presented by Julie Landsiedel from the STEP Wellness. Ready to go?
Yeah, we've got a few minutes left to start. It's only 1:45.
Are you ready to go?
Let's hold on for a few minutes until everybody's able to
Sounds fabulous.
Okay, Julie, if you're ready, it's 1:30, so we will get going right on time, okay?
Sounds fantastic. Welcome everyone today to our little education over lunchtime, or it's a little bit after lunchtime. I am Julie Landsiedel, and I have to say thank you again for asking me to join and share with your group. I've enjoyed every single time. And I actually went back and looked at my presentation from November. And since stress is still such a hot topic, I would actually, if you guys still have that recording, go back and watch that. That was very beneficial. When I looked through it again this weekend. But going through who I am Julie Landsiedel, family nurse practitioner. I live in Bismarck, North Dakota, and the owner of Step Wellness. I'm married to Dave, and I have to put in family because family is so super important in everything that we do in everyday life. So I'm married 25 years this year and I have 3 kids and blessed to be a mother-in-law this past 2 years ago. I am an Air Force veteran, so I super proud of that. I graduated from University of Mary twice. I think I went there 4 times, got 2 degrees. So I always say I think I own a building out there, but my name's still not on it. I've actually been in healthcare. I can't believe it's been 25 years already. Almost 15 of those have been as a nurse practitioner, and then prior as a registered nurse. My experience mainly is in emergency medicine and intensive care, but now for the past 7 years, I've been in private practice with Step Wellness because I just feel through the journey of my own health that we do not educate people enough on their options of wellness. To complement what we're doing in everyday life, the power of food, the power of nutrients, the power of actually eating food, because most of us just do not eat enough. And so I took that turn and I have a more holistic approach to health and helping people empower what they do every day. I'm a certified low glycemic lifestyle coach. So I literally teach people to eat and actually eat. And this past year, I actually became a certified Les Mills body pump instructor. Exercise has always been a huge thing for me. And through kind of everything being shut down in 2020, and I was doing body pump in my garage, I realized I need to do more of this and and kind of help the clients that I work with and everything. So I am teaching twice a week. So I absolutely love that. What I do with that at Step Wellness, lots of different things that I do. But the main thing is I kind of do custom health solutions, custom lifestyle solutions, educating people how to complement what they're already doing with their health, or how to make a change in their health. Nowhere through this conversation am I telling anybody to stop the prescriptions you're on. I know people get really excited when I talk, but we can't do that though. We let medication save lives. But how can we complement sometimes the side effects of those, which lead to stress and everything else that we're doing? One thing where season is coming up is sports physicals. I absolutely love educating, getting time with our youth. So if you know anybody needing sports physicals, I always appreciate a referral for that. And I'll talk about some classes that I have coming up here at the end. So today, what we're going to talk about, I know the topic is stress management. However, I'm going to go back to the basics. I wish I had a magic pill to give you for stress. I wish I did. There's no magic pill for anything. I wish I could put you in a little bubble to prevent all the stress that's going on. I can't do that either. I know this past week I messaged someone, I'm like, I feel like the world is falling apart and I just want to hide somewhere and not come out for a while. Unfortunately, I can't do that either. So we can't change some of that. All we can do is change what we can control. And some of those things are the food that we put in our body, understanding what we're eating and actually eating, looking at, label reading of our medications, of things that are depleting nutrients, which therefore are going to increase the stress response that we have. And literally it's looking at things to help live our best life, optimal life. I wish wellness was a simple journey, but I always say wellness is a journey, but we have to take that first step. It's usually not a straight road. It's usually a little bit more curvy like that, which we definitely found out the last couple years. And I'm really passionate on just the power of food. Again, because for my own self, I've been through the same struggle as the whole world has been, since 2020. And, it really makes a difference what we do for ourselves, of how we can manage what's happening in the world. So definitely the last 6 months, feeling better than I probably ever have since before 2020 by really implementing exactly what I talk about, which I usually do, but I customized it a little bit more. So let's kind of just go back to the beginning a little bit. So why are so many people having health issues other than all the craziness that's happening in the world? There are reasons why chronic illness is a thing. Why are we seeing more autoimmune disorders? Why are people having a more difficult time than ever managing stress? Why are we so fatigued in our society? Well, the American Medical Association has determined that insufficient vitamin intake and a poor diet can be related to chronic disease development and its progression. All those things, vitamin intake and poor diet, also doesn't help us when we need better coping skills for stress in dealing with things that we deal with in everyday life. So it may not be a chronic disease that's developing, but chronic stress can become and lead into a chronic disease and illness. So looking at things like that are very, very important. Stepping back a bit farther, also, today's fruits and vegetables do not have the same nutritious value that they did 30 years ago. We used to say, eat an apple a day keeps the doctor away. Well, the reality is we would have to eat 3 apples a day today to equal the same nutrient value as we did back in the 70s. And so 59% less nutritious value than 40 years ago. So we have to just eat more even to get the same nutrient value, which is very difficult because most people in general do not eat enough. That's the biggest thing I find is, yes, we make sometimes not the best choices for our health, but what I see more than anything is people are not eating enough to feed their body and get the nutrition in. Also, there's lower mineral content in U.S. vegetables. Now, I know this goes way back to 1997, but this has not improved at all. And you can just look over the years how the mineral content, which they're talking about, calcium, magnesium, and iron in cabbage, lettuce, tomatoes, and spinach has drastically gone down over the years. Now, we'll come back and talk about magnesium later here in this discussion because magnesium is very linked to stress or can be beneficial if we have enough magnesium in our system. So you can just see the mineral content has gone down in specific vegetables. And like I said, this has not gotten any better at all. This year was in 2012, the U.S. Department of Agriculture looked at some different nutrients, and they showed statistically significant declines in 5 nutrients. Some of those 5 being protein, calcium, iron, riboflavin, and ascorbic acid. Now, why are those happening? There's multiple reasons. We might be eating differently. Foods are shipped worldwide now. Nutrient value is different because of the different ways that we grow the foods. But those declines can even have to do with the fact that new hybrids are being made. They're making things bigger, growing them faster. Things that you and I may not have much to do with at all, but it does make a big difference in the food nutrients that we are taking in. So this here actually came from 2020, and this was probably before everything kind of started in 2020, but this is very on point. So the USDA had looked at Dietary Guidelines Advisory Committee on nutrients that were deficient in our population. And if you notice that the red ones, and it shows the bottom right, that the red ones are actually public health concern because underconsumption is linked to adverse health outcomes. So it's not that we're just not getting enough nutrients and just kind of staying, main level, not optimal wellness, but these are actually a public health concern. Top of the list, vitamin D. I've been ranting on vitamin D for years. And I always say no one wanted to listen to me because they're always like, I get enough sun and all these things that I hear. Vitamin D is critically low in our society, so low that it's actually linked to adverse health outcomes. Over the last couple of years, vitamin D has become very known as being very helpful for immune health. And so it's helpful for many other things, for bone health, for depression. There's all kinds of things. I'll talk about vitamin D a little bit later, but these are what's low. So vitamin A, E, C, folate, magnesium, we talked about. Critically low being vitamin D, calcium, potassium, fiber, and iron. So we are just not getting enough nutrients in our foods that we are taking. Also, the previous slide said that a lot of our foods are grown faster, or they're induced to become riper. Foods get their nutrients as they ripen. So if you pick something before it's actually ripe, the nutrient value isn't there yet. The ripening process actually gives us those nutrients. Because foods are shipped all over the United States and probably the world, you can't pick a tomato in California that's ripe or a strawberry that's ripe and ship it to Bismarck, North Dakota, because by then it'll be spoiled by then. So they actually pick lots of fruits and vegetables before they're ripe, so they can be shipped to their location, and then they induce the ripeness with ethylene. So on top of the fact that we're adding ethylene to food, we're not getting the nutrient value because the process actually never happened for the ripening process. And I've seen images, which I don't have in here today, where, when they get their strawberries, they're all green, but then they spray them to induce it once they arrive. That's like mortifying to me. I had no idea that was actually a thing that happened. So that's definitely a concern. Also, if someone's having to wear a hazmat suit to spray the vegetables that you are being then later consuming, that is a concern. This should not be happening. So there's so many reasons why we aren't getting enough nutrients in, but also a lot of times if we don't shop properly, we might be getting additional pesticides and things in that are also not good for our health, which contribute to a whole multitude of issues, which really is a whole nother seminar on another day. And then we have what is called the standard American diet. We are the most financially stable country in the world, but we have the most nutrient deficiency of anyone. And it's because in comparison to the amount of food that we have, the standard American diet is actually called the SAD diet in studies because we do not get enough nutrients from what it is. Lots of grains, lots of fried foods, deep fried foods, grease, things like that. Most things it's because we're, need quicker eating. We're not shopping for our household. We're not cooking at home. We're going through a drive-through or boxed windows, all of this stuff. And this definitely greatly decreases the amount of nutrients that we are getting in our system. This always makes my head spin a little bit. Did you know that according to information, French fries were one of the 3 most common vegetables consumed by infants 9 to 11 months of age? French fries. That makes one very, very shocked. So French fries would not be the #1 vegetable our children should be having. And by 15 to 18 months, French fries were the most common vegetable. And that is according to PubMed. And that's the study, their information that they had acquired. We can see, again, so this is no surprise why we are seeing issues of stress, anxiety, behavioral disorders, things happening in younger and younger ages. My office is within a building, a practice called the Kids Therapy Center. So I rent a space within there. So I work directly with Val Myers on adult education while they work with the children's education. And it's amazing the power of food, how it helps your mental health, but also the power of food, how it can be drastically detrimental to your mental health. So we definitely have to change the French fries being the #1 vegetable happening. So why do we need to supplement? Why? One is that for all the reasons I just said, we don't get enough of the essential minerals in. We have an American SAD diet, which does not have the nutrients in there. A lot of the phytonutrients that we often need are really hard to obtain from food. For instance, antioxidants, we'd have to eat bushels and bushels of berries per day. Now, I love a good blueberry and I love blackberries, but I can't eat bushel of them every day to get enough phytonutrients in from that. And also supplementation is very beneficial for all kinds of health things, joint health, skin health, sleep. If it was all so simple, we would just do it. There's many things that are affecting how we can improve our health, and that's where supplementation can be very beneficial. Now, what if you're thinking, but I eat good, because I do hear this a lot, but I eat good, I buy organic, I don't eat any grains, I don't do this, I exercise, I eat the best I can. Why do I still need supplementation? Well, this is a screenshot you can take right here. And it's because of the prescriptions and the over-counter medications that we all take. We all know somebody who takes them, I'm just going to say. So this is called, from the physician's desk reference, it is drugs that gobble vitamins. And you can screenshot this, or you can go to the internet and download it. What it is the type of drugs on the left of the thing. The middle is the name of the medications or over-the-counter medications and the nutrients that are depleted. So if we just look at things that deal with stress, which is B supplements, magnesium, vitamin D, things like that, or fatigue, B supplements, things like that. I pulled those out on the left side of the screen. So antidepressants, the use of antidepressants has gone up immensely. It's always prevalent. But it's often the first line thing that someone does, a provider does when someone comes in. And it's not that antidepressants aren't beneficial, but if you are on an antidepressant, B supplements are depleted, as is CoQ10. Well, B supplements are very beneficial for our energy and our stress and our anxiety. So we may be taking a prescription that is to help with our depression. A lot of times depression, your symptomology may be that you are fatigued and you are tired and you are stressed. So definitely, if you know anybody on antidepressants, have them start some B supplements. If you know anybody taking any anti-inflammatories or pain medications, B supplements, vitamin D, magnesium, those are very beneficial in our immune health, in our stress and anxiety, for sleep, for headaches. So sometimes we're taking things to counteract one thing, but we're depleting nutrients in another. So if you're on anti-inflammatories, start by just replenishing those nutrients. Anybody on birth control, B supplements and magnesium. Diabetic medications. Again, these are not medications you can stop. None of these you stop, but you can complement by adding B supplements, vitamin C and CoQ10. To that, if you're diabetic medications and antacids, the whole world has heartburn and reflux. The whole world. I don't care what your age is, everybody has heartburn and reflux. And I've always seen people with it, but the prevalence has drastically quadrupled or more than that, because chronic long-term stress has so many effects on our system. One is going to be in the digestive system, and reflux and heartburn has become so prevalent. So I'm seeing more antacid use. Now, I would recommend doing something more natural, like an ultimate aloe, something like that, because it's in soothe and heal. However, if you are taking antacids, but B supplements, vitamin D and calcium are going to be something that you want to add. So if you don't know where to start in what's happening in your world, just go by this. If you're someone who's on a lot of medications, prescription or over the counter, just start by replenishing the nutrients that are being depleted by what you're taking to already help improve your health. So let's look at a couple things that are essential. Now, nutrients are essential. I'm going to talk a little bit more specific to just getting basic nutrients in and complementing or helping stress, anxiety, things like that. But there are many nutrients that are essential. Omegas are very, very essential to mental health, to joint health, eye health. So omegas, fish oils are very, very beneficial as another one. Again, I'm not going to be talking about that today, but that's a big one. Again, like it says there, I wish there was an easy button. Remember the Staples easy button? There is not one, but there are steps that we can take to help address. So one is, everybody needs to be on a good multivitamin. I don't care how good you eat. It does not matter. We are in a world of chronic stress. Even if you are managing it better today than you were a year ago, our world is what's in chronic stress. We are not meant to be in that. Stress is a good thing. It gets our energy going. It gets our metabolism going. We can be more productive. Long-term chronic stress is not good for us. It literally wears us down. And that's what I'm seeing now, 2.5 years later, is just everybody is tired, and we're seeing all these kind of like lingering chronic symptoms starting to happen, whether it be fatigue, weight gain is a big one, body fat increase, cortisol levels being thrown off, people can't sleep, headaches are more prevalent. Everything's more prevalent. I'll rant on exercising, but how do you exercise if you don't have enough energy to exercise? It's like that. Which comes first? How do I get that done? So one is we need to have a good multivitamin in, one to help with our energy, metabolism, adaptation to stress, nerves. It is so, so important to have a good multivitamin. Now, I think there's many good multivitamins out there. With multivitamins, I feel like all of them have good nutrients in them. If you're looking at the two left columns there, they all have, they're all going to have over 100% of the daily value, all those kind of things. What you want to look at though in multivitamins, because I'm very big on label reading. And the reason I say that is because I truly thought prior to 2010, a supplement was a supplement. I thought all supplements were created equal. And I thought if something said it was a supplement on it, it meant it was healthy for you. Supplements are no different than food labels. You have to read food labels. You have to read supplement labels. So you want to look with one that does not have a lot of additional ingredients in there. So things like hydrogenated palm oil. You don't need dyes in any supplement that you're taking. You don't need dyes in there. It does not have to be a purple little pretty pill. It is well known in the mental health world that red dye number 40 can be very agitating to children and adults with different symptoms and diagnoses. And talc, if you look, was it fourth from the bottom of the ingredients, there is talc in this multivitamin. So I know pills, a lot of pills, they have to have a binder to stick together. You want to find one that has either no binder or ones that are more naturally made. Talc is, I'm just going to say I'm not a big pill taker, and I was never a supplement taker prior to 2010 because I took pills to help myself that had talc in them because I didn't know to read the label, because I just thought they were all good for you. And I would normally get constipated and nauseated from them. Well, after I learned what I learned, I don't think it's good for anybody to wake up in the morning and drink baby powder. I don't get up and say, oh, let's have some baby powder for breakfast. Well, that's what talc is. So you want to look for labels that do not have ingredients that could be very irritating to your GI system, may prevent you from digesting it, which therefore a lot of times also you're noticing nausea and constipation. So just be more educated on the supplements that you purchase, especially with the multivitamin. So with the multivitamin, literally what's missing is the best thing, because they usually all have good nutrients in them, but you want ones that are clean, easily digested, do not have binders and fillers in there. So let's look at a couple nutrients that are more specific, that are depleted with stress, that we can choose to supplement, which therefore will then help with our sleep and stress. Because a lot of times when we're stressed, we're not sleeping. And that's what I was dealing with for the last year. It's like, I feel like the chronic stress hits so much, it's almost normal for us, but we're not sleeping. And if we're not sleeping, we're more stressed. And it's this big cycle. So we need to address things that are depleted from our system because of stress that we can replenish back. So these are a couple ones that are options that you can add back in to assist with your health. One being vitamin B. B supplements are super, super important. So what are some signs of low B vitamins? One can be muscle weakness, headaches, and stress. So low B vitamins, you will feel stress from them. But guess what? Stress also depletes your B vitamins. You cannot literally get too many B vitamins in your body. Irritability, confusion, mouth sores, sore throat. I've had so many complaints of sore throats, which not related to an illness, because I think this last year, because I think literally everybody is so depleted in Bs. Short-term memory, I feel like I've noticed that more and more. Maybe it's just my age, but short-term memory is going down. So what depletes B supplements? Well, we talked about stress, but also alcohol, sugar, coffee, stress, and exercise. So it doesn't have, and exercise is good, but good things can also deplete B supplements. And then we talked about medications. And the thing is, the last couple of years, alcohol use has gone up. I always say I've never met a sugar that I didn't like, because I'm Julie, the sugar addict, and have been. I've just had to take some steps to learn how to control it. So these are the things that help deplete B vitamins. And so these are reasons why we need to supplement. So why supplement with a B complex? I've had a lot of people come to me and they're taking like just a B12, because I think it's common in our world, either by your provider or just by research, that you find out B12 is very important for energy. And that is absolutely the truth. However, we need all B supplements to work synergistically together. You're just not low in one. Now, in testing, you might find B12 might be low, but then we want to supplement with all of them, because the B complex all work together to work on your metabolism, on your energy, which help with your hormones, which therefore can help with your stress. B vitamins are depleted by stress. It's like I said, it's kind of a vicious cycle. B supplements are also water soluble, so they have to be replenished every day. We do not make Bs in our body, so we have to take them. So it's one of those things, we do not make them, we have to take them. Some people need to take them several times a day. My daughter is one of them. She takes B's complex 2 to 3 times a day. I'm fine with taking it once a day, just like everybody is different, but we do need to get B supplements into our body. If there's one thing, if you're thinking, I am super, super stressed, this is something you definitely want to look at. So what are some of the benefits? Again, here's just a little infographic. One is keeping your weight in check. I'll talk about a class I have running here starting July 5th, but I've had so many people come to me that over the last couple of years, for whatever the reasons may be, and it could be the increased stress, is that their weight has gone up. And so whether it's on the scale, or they're just feeling not good in their clothes, or just not feeling good in their body, or they're just fatigued, things like that. The thing is, B supplements actually help regulation of the thyroid, which therefore helps keep our weight in check. Now, I'm not saying if you have, don't have a thyroid, it's going to fix that issue. No, but our hormones are regulated in our body to help with our weight. And if our B supplements are low, that is going to affect our weight. So when I have people coming to me looking, I just need to lose weight. And again, I'm not an advocate for the scale at all, but I just want to fit better in my clothes that now are in a closet from 2.5 years ago. One is, let's look at adding some B complex. Other things that B complex is good for, it's great for your heart. It's great for stress, which I've already said. It's great for beauty, because biotin is in B7. Biotin is great for the skin. That's what people are looking, that's the nutrient for skin health. And it's great for immune health. So B supplement is going to, one thing that you could add, because the thing is, we can only control what we can control, and we can control what we take into our body to help with our health. So B supplements are one of them. Let's go on to the next one. Oh, I was going to say one more thing with the B supplements. You also want to get one that is activated, because about half our population has methylation or MTHFR. Don't get concerned on, what it is. You can get tested for it. But what it is we cannot convert certain B supplements into the active form. I have MTHFR, which was why I didn't notice anything when I took a non-activated B complex, because my body cannot convert it to the active form of the Bs. So I always recommend people actually purchase, just read on the label that it's an activated B complex instead. So just doing that. Another one, magnesium. Oh my God, magnesium is like a godsend. If I run out of magnesium, I'm hunting it down in Bismarck. So it helps with cognitive health, sleep, and just overall healthy habits. So magnesium, it is the 4th most abundant nutrient in our body. Most of us know nothing about it. So it helps in so many areas. So benefits of magnesium, it helps relieve pain, specifically headaches and migraines. I was someone who lived with migraine headaches into my mid 40s or early 40s until I learned more about wellness. And I learned that magnesium is the #1 nutrient recommended by neurologists for migraine headaches. nutrient wise, I'm not saying prescription. I obviously saw the wrong health providers or neurologists for the umpteen years that I was seeing for migraine headaches. When I changed my diet to decrease inflammation, keep my blood sugar stable, and added magnesium, I next to never have a migraine headache. If you're someone who deals with migraine headaches, you need to look at adding magnesium to your diet, 100%. Magnesium also helps with sleep. The big thing, helps with mood, helps with muscle tension. Restless legs or leg cramps have become huge the last 2.5 years. Everything that you're seeing on that left side of the screen where it says kind of what it benefits there, I have seen so many people with those complaints the last 2.5 years. It's because we are depleted in magnesium. It also does help lower the risk of diabetes. Now it's going to resolve if you have diabetes, but it helps lower the risk of it. But stress, muscle tension, leg cramps, mood, sleep, and headaches are huge complaints. Another complaint is constipation. And I wish it should actually be on here. Constipation is a huge complaint for people. Magnesium can be extremely beneficial. So if you're having any of those symptoms I just talked about, this would be good to look at it. So warning signs of magnesium deficiency. Now this is getting a little bit dramatic. You don't have to wait till you have these to start magnesium, but these are warning signs, bigger signs if you're having magnesium deficiency. Ringing in the ears, again, another huge complaint these last 2 years. So if you notice ringing in the ears, might be magnesium. Muscle cramps or spasms, depression, fatigue, kidney stones, abnormal heart function. A nurse practitioner friend of mine who's a mental health nurse practitioner, the first thing she puts her clients on is magnesium when they come to her office. She's more of a holistic mental health nurse practitioner, and magnesium is her #1 for mood, depression, all the topics, stress that we're talking about. So 60% of US adults are deficient in magnesium. So that's a big number. And that number might have gone up the last couple of years. I don't know that answer. So magnesium, very, very important. Dietary intake is particularly low among women. So if you're a woman in the group here, might be why we need a little bit more. However, I can tell you that my youngest son and my husband use magnesium every day, cannot go without it. So for all these reasons, sleep, head comfort, constipation, leg cramps, any of these, this might be something good to add into your diet is magnesium. Another one I'm going to add, now this one's not necessarily vitamin D depleted by stress, but when vitamin D is low, it contributes to depression, fatigue, body aches, etc., which can be mulled in when we're already not feeling good from stress and anxiety. Anything that brings down our energy level or our mood is not going to be a good thing. So vitamin D literally can probably be the most cost-effective, beneficial supplement that you purchase. I know, it's great to get out and go walking in the mornings. I love that. And I wish we all did that. I don't know that we all do that, but really we still want to be taking a vitamin D supplement. I used my kids as guinea pigs. My son, after one summer, and they're out in the river all summer long, his vitamin D was still in the low 30s. And that is too low to have, even when he was out in the sun all summer. It's very hard to get enough of it from the food that we eat. Some of the top ones that we can get it from are eggs, dairy, and fish. Well, I don't know, how much fish do we eat here? We might go fishing in the summer and get some walleye, but the reality is where we live, we don't necessarily have a lot of fish. Eggs and dairy are great options. However, lots of people do not eat eggs and dairy because of food sensitivities. And so, because honestly, when you come to me, I'm probably going to tell you to avoid dairy if you're having some issues, GI issues, weight issues. And I'll tell you my story. My vitamin D has been pretty good. I've been in the 80s for quite a while. And I was having some issues with my gallbladder, did a food sensitivity test, found out I was heavily sensitive to eggs and dairy. So I took those out of my diet. Over the next couple months, it was about 3 months later, I noticed, oh my God, I am so tired. And like my body just ached. Going through all the normal things, I finally was like, I'm going to check my vitamin D level. My vitamin D level had dropped down into the 40s. I had changed nothing other than took out eggs and dairy. Eggs are one of the #1 foods that I would say the average population eats in a day that has vitamin D in it. So I had to start supplementing at a higher level because I changed my diet by taking eggs out. And I'm not alone in that. So just know that that can be a big thing, because a lot of times if someone's having gallbladder issues, eggs are a huge trigger. So if you're eliminating those for whatever reason, that's going to make a difference. So more than 1 billion people worldwide do not get enough vitamin D in. More than 50% of postmenopausal women they have suboptimal levels of vitamin D, and you're not going to absorb your calcium as well without adequate vitamin D. So I've seen a lot of people take tons of calcium over the years, and calcium is a great supplement. I'm definitely doing that. But if you're not getting enough vitamin D in, you're also not absorbing. So then you're going to see a lot of issues with bone health that's happening. So you definitely want to get those in. So question, do our vitamin D needs go up or down with age? Well, definitely they go up. So less than 45% of adults older than 50 have adequate levels. So we need to supplement. So how much do we need to supplement? I know this says Parkinson's here. I'm just going to say I did a presentation for the Parkinson's Association in Bismarck, and just doing some education or research on there that in Parkinson's, vitamin D, and this is for everybody, vitamin D is known to benefit our health by regulating the amount of calcium and phosphate in our body, which therefore helps our bones and teeth. Vitamin D also helps prevent or delay the onset of cognitive impairment and depressive symptoms. That is not just for Parkinson's, that's for anybody. This was specific to Parkinson's, that by increasing their vitamin D level, they were able to, around 30% have cognitive impairment or dementia. But in an everyday world, vitamin D does help us. So if you know anyone with Parkinson's, you definitely want to make sure their vitamin D levels are up. This was a very big topic with the Parkinson's group, but this is relevant to all of us who are dealing with stress, anxiety, which leads to depression. So you want an optimal level of 60 to 80 of your vitamin D. Now, I know when you get your vitamin D checked at the clinic, if they do test it, if it's 31, they're going to call you on the phone and say, hey, Mary, your vitamin D is fine. That is not fine. It needs to be 60 to 80 for optimal wellness. 31 is to prevent rickets. There's a whole level of things that we're looking at. Yes, we want to prevent rickets, but that we want way more than that. So your job when you get your vitamin D level is, if they say it's good, you ask, what's my number? If they say it's bad, you're going to ask, what's my number? Write down that number, because if you come to me, I'm going to ask you, what's your number? Because someone telling you that, oh, no, Mary, it's all good, that doesn't mean anything to me, because 31 from 61 are very different and how it's going to be beneficial to your health. So you need to know what your level is. I recommend 5,000 to 10,000 IUs per day, but this will also be varied on what in an evaluation of your symptoms or if you know what your vitamin D level is. So those are some supplements that you can add to your diet to help with any stress, anxiety, things like that. So the thing is, how we eat, move, hydrate, supplement, feel, think, and sleep all matter on a daily basis. Again, there's not a magic pill or one thing to do. It is accumulation of things. Another thing that's huge for stress is exercise of any kind improves your mental health, your immune health, helps with stress, with anxiety, helps you pass time through the day. I can tell you, I've always exercised for years, but I, like the rest of the world, mine decreased over 20 and 21, partly because everything was not happening. And I can tell you for the last year and a half now, I have dedicatedly been back to exercise, and it is so beneficial to my mental health. The number one reason I became a body pump instructor was because of my mental health, and I want to help others with their mental health. So yes, and it does help us feel better about our body. And yes, it'll help us, lose some body fat. But the number one thing I feel it helps with is our mental health. You cannot do too many positive things to help decrease stress and anxiety in your world. So, here's some different things that it helps with. And one being reduces stress, helps burn fat, helps our mood. And you're wondering, well, where I don't have time to exercise. I just had this yesterday. I had a pharmacist who said, what do I do when I work for 12 hours a day and I don't have time to exercise? That's a great question. And I understand that because I work 12-hour shifts in the ER as well. One is we got to take a step back. And during those 12 hours, we need to keep eating every 3 hours. We need to take our supplements. We have to keep feeding our body. We can't put our body through hell through those 12 or 14 hours of work that we have, that's our job. And then expect our body to perform optimally afterwards by exercise or even just dealing with stressors at home. We have to take care of ourselves during those 12 hours of work. Keep eating. You can't go all day without eating. But one thing we did talk about is she's going to do squats. So when she doesn't have patients or clients at the front of the window, she's going to do squats. And that's what she's going to do during work time to get some exercise in. And then she even said she's going to do a challenge with her employees within the pharmacy in town here, is that they're going to have a squat challenge in the clinic or in the pharmacy during their long shifts to keep them moving, and anything that they can do for helping with muscle. Another one I recommended was a planking challenge, doing some push-ups. Yes, if you can then have, organized exercise, whether it's at home, whether it's at a gym, things like that, going for a walk, the weather's beautiful, all of that is good. But we have to fit in what we can, because we can't quit our job, can't leave our job, but we do have to eat. And I'm the queen of not eating in 14 hours when I worked in the ER. It did not work for my health. It was way better once I started eating every 3 hours in the ER, because then my energy went up and I was able to be more productive in everything that I did. So make sure you get exercise, find a friend. If you're looking for any information on exercise, you can go to stepintotls.com. Under resources, there's a whole fitness thing with exercises, things like that. So next thing that you can do for your stress is you have to eat. You cannot eat less. You have to eat better. I just had someone come to me that she wants to lose 10 pounds. Okay, first place, I'm not about pounds at all, but she wanted to lose some weight. She's eating 3 protein bars a day, and that's it. You guys, that is not going to help you lose weight. You might lose pounds on the scale because you're losing protein in your muscles, in your body. That is nowhere going to increase your metabolism, and that is only going to increase your stress and your anxiety. Please eat better. Do not eat less. Make better choices. So here's just an indication of some things that you can eat. And here's a list of foods, vegetables. You have to eat good fats. You have to eat protein. You have to eat the fruits because it got the fiber. Don't be drinking the juices. Low glycemic starches are down there because we're going to have starches, but we want to make sure that they're not impacting our blood sugar too much. But I want you to look is on the right side of the screen. I pulled that from the top of that, is you have to eat several times a day, every 3 hours. And I know you're like, I don't have time to eat. Well, number one, eat breakfast. I know I'm ranting now, but I get really excited because these are the things that we can control in our everyday health to help our stress and anxiety. So make sure you eat breakfast. Have protein for breakfast, whatever it may be. Having cereal is probably not going to be the best thing for you. You always want to look at protein and fiber at every meal. You can have a shake, but make sure you read the label of a shake so that it has good protein. They all have good protein. It has to have good fiber and a low sugar impact. I'm very big on glycemic impact and keeping a steady blood sugar. And so looking at, so again, breakfast, snack, lunch, snack, and dinner, you have to be eating. If there's one thing, again, there's a lot of one things that you can do, but you're like, I just want to change my food, eat more frequently. More than likely, you're not eating horribly. You're just not eating enough. And if you don't eat enough, your body fat stores around in your body, just like a bear in hibernation. Because your body has to function. And if you're eating very little, it's like, oh, I'm going to store this because it's not going to feed me again for a while. And guess where it generally stores is in that belly and hip area, because belly fat complaints have drastically gone up because stress increases belly fat and not eating enough increases belly fat. So make sure you eat enough. Again, eat smarter, not less. If you just remember, protein and fiber at every meal makes burning fat no big deal. So every time you eat, protein and fiber, protein and fiber. So wherever you're at, make sure you get your protein and fiber in. You're going to be 10 steps ahead right there, as well as by eating more frequently. And the next couple slides here, I'm going to go through some, because I wanted to send you home with tools of what you can use. So you know what supplements you can put in your body. You know you need to eat more. You need to eat more protein and fiber, because these are all going to come back and help your stress level. It's all going to do that. So one is label reading. I am a huge, huge, huge advocate of label reading and knowing what's in your foods, knowing what the net carb of something is, because the net carb is actually what impacts your blood sugar. So if you keep a steady blood sugar, besides all the medical things that it benefits, it also helps your metabolism burn better. It helps keep your body fat down. It keeps your mood and energy stable, because you're not going up and down and crashing, drinking the Mountain Dew. Oh God, don't drink Mountain Dew, and crashing down. And, afterwards, this is what happens. And that's how our body fat is stored, as well as increases our anxiety. So I'm going to do in my classes, what I call label reading 101. This is what I do at my education sessions in my office. So I thought I would share this with you. And so because the goal for me is to be an educated consumer for your health. All these little tidbits are going to help. I hate to say indirectly, but it's all these little things that are going to help directly with your stress, anxiety, and managing life in its chaos. So label reading. We've all seen the nutrition label. This is my time. All seen the nutrition label. So making sure that you know what the serving size is. I'm a huge advocate of not counting calories. I know it's a whole nother discussion. You can, talk with me about that afterwards. Send me messages. Calories do not tell you how many nutrients you are getting in your body, because most people then starve themselves to conserve their calories to save them later and eat once a day. That does not work. When you're looking at fat, you want 5 grams of fat or less per serving, except if they're good fat. So if it's got avocado and things like that, that might be different. When we're looking at the net carbs, we want that in a single digit. Next slide, I believe I'm going to have that in there. Maybe it was a previous slide, but we'll go through that. You want at least 5 grams of fiber per serving in the foods. That's a big one. When you are buying something, it needs to have fiber in there, unless it's something that just would not. But if you're buying a protein bar, you're drinking a shake, you're eating, anything, you have to have fiber in there, because that helps keep the glycemic impact down and keep your blood sugar stable. You want 5 grams or less of sugar. Now remember, lactose is a sugar, but 5 grams or less. And I'm even more anal on knowing what kind of sugars those are. So I'm going to go through those. 5 grams of at least of protein, and knowing that the fewer ingredients there are, the better, because the longer the list is, the more apt there's something not good in there. And then also knowing that in the ingredients, they are listed from highest to lowest. So if sugar is the first ingredient versus the 20th ingredient, there's less sugar in there. So looking at ingredients in their highest to lowest that they go. I'm going to go back a slide here. Let's see once here. Okay, so let's talk a little bit about sugars, because this is a big topic. People are like, I don't know what sugars to have. And this is probably one of the biggest questions I get in my office. And so let's go through sugars. Red light, green light, and yellow light. So red light means absolutely not. Aspartame is an absolute no. As my friend Lisa always says, you would not just give a little bit of rat poison to your kids. Just something like just a little bit. Nope, you would never do that. Aspartame is literally like rat poison. It is very triggering to headaches, anxiety, your mood, everything. So we do not need anything that triggers more anxiety in our health. We do not need to give ourselves more headaches. And also it does not help with our appetite, because I think a lot of people think, well, I drink diet soda because it doesn't have sugar in it, but it has aspartame in it. And I know there's been some changes in sodas. You still have to read the labels of what they are. So, and that's a whole nother discussion. Soda is an unnecessary amount of things that are coming in that has no nutrient benefit to you. This is your temple. You need to feed it as such. Also knowing saccharin is not good. So these are not good. So when you're reading labels, and I can promise you, if you are buying things at a store without reading a label, you will by accident buy something with aspartame in it. If you're a big gum chewer, did you know that gum is has been one of the biggest contributors to aspartame? Now they have gotten better, but you have to read the label because you do not want to be feeding yourself aspartame with every chew of the gum. That's what I used to do without knowing. It made a huge difference. So let's go. So these are no. And so when they say something is sugar-free or sweet, like sugar-free, you and I think it means no sweeteners or sugar. It just means no sucrose. It doesn't necessarily mean there's no sweetener in there. So you have to read labels. These are the yellow light sweeteners. So these are the better options. You'll see these a lot in, foods, baked goods, bars, shakes. These are better alternative to sugars. So sucralose is one. Whey-low I never see, so it's not one that I see a whole lot. Sugar alcohols, you're going to see a ton of them. So maltitol, sorbitol, erythritol, they all are wonderful sweeteners that can be used. Xylitol, you will now find in gums. So look at some of the gums. Erythritol has the least GI side effects. What that means is because sugar alcohols don't absorb in the GI system, some people will get an upset stomach, gas, bloating, diarrhea sometimes, not everybody, but some will. So first of all, you don't want something with a lot of sugar alcohols, but erythritol has the least GI side effects. I actually use erythritol all the time at home in different things. So these are better sweeteners than sugar or when you're reading labels. Some other ones are agave. It's like honey, kind of pours like honey. Agave is expensive to make, so they make it cheaper and not as healthy for you. So when you're buying agave, you want to look for a raw certified and organic low GI seal. So if you're at Dan's Supermarket or Cashwise and you see different agave on the shelf, they're wonderful sweeteners. Just look for that raw certified and the low GI seal on there. Then you'll know that it's a better option. And then coconut sugar and coconut nectar, those are also a better one. Only have a glycemic index of 35. That's very low on the scale because it is minimally processed. So those are the better options. So those are the yellow light ones. Those are good in moderation as any sweetener will be. But the green light ones, so if you have the option between stevia or, one of the like erythritol, you would go with stevia. These are the best options that you can go with. These do not negatively impact your blood sugar. Again, you still want to use them in moderation, but you want to read labels that have one of these in there if there's going to be a sweetener. Again, please don't there's a tea at the grocery store we saw that said sugar-free on front. And it was this pretty purple lavender color with flowers. And one of my clients bought it and she called me. She was so excited. And I said, flip over and read the ingredients. And the first ingredient was aspartame. So you have to flip over labels and read the ingredients. Always remember the front of a label is marketing. Someone went to school to market that. So you need to flip over the label and be an educated consumer. These are the best sweeteners for you. Monk fruit, stevia, yacon syrup. I've not seen yacon syrup yet in Bismarck in anything, but it is a very low glycemic index, and they say it tastes similar to honey. I've not found it yet, but as soon as I do, I will purchase it and check it out. So these, knowing your red light, green light, and yellow light sweeteners is super, super important because again, this is one other contributor to keeping your blood sugar stable. This is the net carb formula. Again, you can screenshot this. And what you're going to figure out is, and again, don't get overwhelmed with me at the moment, but when you're looking at the net carbs, the formula here says total carbs minus the dietary fiber. So you can see that the more fiber in anything that you intake, the lower the glycemic impact is going to be. It's just math. So always look for something with a lot of fiber. If you have sugar alcohols in there, it does bring down that glycemic impact as well. I have one whole week in my class that I go through the net carb formula. If you can look at this, the thing is they focus on this once someone is diabetic. What we should be focusing on this before we become diabetic, because maybe it would affect from that type 2 diabetes happening. So the power of food and keeping your blood sugar stable is very, very important. So you cannot live in a bubble to avoid stress. I wish you could. But by stabilizing your blood sugar levels with healthy foods, you will manage your stress better. So this is one portion of the many things you can do and what we take into our body. I know we can't control a lot out here, but we can control what happens to us and to our families and what we take in. Remember that you are worth it. I think that's the biggest thing is people don't want to take time for themselves. You're too busy. All of this, the thing is you can only be your best you if you feel your best you, whether it's your wife, mother, husband, employer, employee, helping the community, it doesn't matter. We're all beginning to feel the exhaustion from the last couple years. And we have to take the time for ourselves because you are worth it. Do not forget that. So if you're wondering, where do I go from here? You're like, oh my God, you gave me a lot of info. I know I always do because I love to rant on health and give you your options, but you're like, okay, but where do I start? Step one, there is a survey you can do, and I can sure send this out. They can have me send this to them. There's a survey that I do. You can go through that survey and go through and answer the questions for you and your family if you want. And just think, if there was one thing that I could change about my health today or prevent in the future, what would it be? And then you can contact me, my information at the end, and I offer free wellness consults to any groups that I visit with. Because I thank you for letting me share on health and wellness for you. And if I can assist, I will meet with you one-on-one. We can go through this survey and I can help customize what would be best for you based on what you're looking for. There is no commitment for you to do anything through my office. There's no commitment that you have to, purchase a package for wellness. I just want to help you be your best you. And so we can do that. So there's you can screenshot these if you want, or I can send this out and then you can contact me for that free wellness consult. If you're thinking, I'm kind of ready to do something right now, I just wanted to share this, that I am starting a shrink a size class starting July 5th. It's 5 weeks. So it's going to go July 5th through August 9th. It will be virtually, though we can meet in person in Bismarck. Also, if people are choosing, it kind of depends. The whole goal is we're not getting on the scale, nothing like that. Grab a pair of pants or shorts or something that no longer fits that still happen to be your favorite. And we're going to go through 5 weeks of reading labels, low glycemic eating, learning how to get our energy back, learning some exercise. We're going to focus on all that. So if you're interested in that, again, just send me a text or an email. I will get you the information for that. If you just want to learn more, like what is it? I actually did an overview last night. I can share that link with anybody to watch that. But that would be a great accountability for 5 weeks, kind of rolling through the rest of the summer. Again, just to feel your best. So either one of those is a great option. But again, I do offer free consults, so we can do that that survey, lifestyle survey, and see, what are you looking for? And is there anything that you can add in to help with your lifestyle, therefore helping manage stress and chaos in the world? So in your offices, since I got this idea from the pharmacist I had met with, in each of your offices or amongst yourselves, have an accountability group for exercise, whether it be planking, whether it be push-ups, whether it be doing 50 squats, whatever it may be, make it fun. All those little things are going to help decrease your stress, feel better, increase your energy, and therefore help manage our beautiful life that we have moving forward. So any questions at all? I know they were going to hold off and answer questions at the end. I am open to answering any questions that you like.
Hey, Julie, we've got a few questions. First one, are there different kinds of vitamin D? And if so, what is the best one to take? There's several brands. There's multiple brands. One is you want vitamin D with K2. So
Yes, because you want the ones that are no, K3, sorry, that have, oh, hang on a second. Let me grab, yeah, vitamin D with K3 is what you want, because you want it where it doesn't interfere with any clotting issues, because you want the K in there, but not the one that interferes with that. So it's vitamin D. It's vitamin D2 with K3 is actually what it is. I'm getting my 2s and 3s mixed around. I am a very big advocate of an isotonic formulation because so many people I see have digestive health issues, whether it be from actually, having Crohn's or IBS. Stress slows down our digestive system. If you've had gastric bypass, we're not absorbing nutrients. There's multiple reasons people don't absorb nutrients as well. The two that I have found that work the best, and this is from testing, and I've definitely not tested all of them, but having clients, one is an isotonic formulation and one was a spray that was under the tongue, but I'd have to look what the brand was because it went right into the sublingual and it had a good absorption with it.
The next one is, what multivitamin would you recommend?
Multivitamin, I think there's lots of good ones out there. Look for one that does not have any sugar added to that. So that no added sugars, depending what you want. There are some gummies, but you have to look at the gummies. Again, you have to look at them. I'm not an advocate of like Centrum, things like that. Those just do not absorb very well. Again, I'll say again, I do use an isotonic formulation in my office that I do have a lot of clients that use that because there's no pill to break down. However, I do have a lot of people bring ones, capsules. There's not really multivitamins in capsules, but there are some gummies that are okay. I can't say the brand off the top of my head, but there was one at Target that I was reading the label in when I was standing in the checkout line that did not have, or the sweetener that was added was not sugar. It was not aspartame, things like that. So there was a gummy at Target. Those would be the two that I know of. I will honestly say that anytime you buy something, you have to read the label because they change them all the time. I'm also very open. If someone has a label they want me to read, you can definitely text it to me. I have lots of people who text labels from their cabinet at home or from the grocery store, and I can help read that. You can also use the list of the sweeteners that I had listed on there and just kind of avoiding some of those because most of them have good nutrients in them. Just it's what else is added to them.
Okay, and I think you addressed this one. What are your thoughts on multivitamin gummies?
Okay, yes. So it's kind of changed a little bit. So back in the day, meaning 5 years ago, I was absolutely no, because gummies originally were made for kids, and to get they would add sugar to them. So like the Flintstones vitamins, the Flintstones gummies, those actually had sugar and aspartame in them prior to 2014. So I used to be absolutely no gummies because gummies were generally made to look like candy. So that was a no. That has shifted in the last couple years because again, you have to read the label. Some of them are sweetened with stevia. Some of them just with some natural fruit juices. Sometimes I'm even seeing beet juice added to them, which is a great option. I've seen some adding curcumin to them. Some of them are adding vitamin D to them. So gummies, it's actually gone more on the yes side, but I can't say yes without reading the label of it because some of them still are sugar coated to make them taste good. Well, they're always like, well, it tastes better. That's because sugar always tastes good. Sugar in anything tastes good. It's not the gummy that tastes better, it's the sugar. So looking at gum, so I can't say yes or no until I read the label, but they have gotten better. So it doesn't mean a flat no. You just want to read the label of what actually is in it, what it's sweetened with. Good question.
And then Tiffany said, great information. Thank you, Julie.
You're welcome.
And Chantel said, such great information. Love your energy. Thank you so much.
Thanks so much. I always enjoy sharing with you guys.
Is there any more questions?
No, and feel free if you just have something you didn't want to share, publicly. I do understand that. Just send me an email at julie@stepwellness.com or just text me. It's perfectly fine. I do a lot via text. Everybody's in a busy world. Just say we were online today and on this seminar. If you have a question, I can definitely help answer a question if it's something more private. I just want to be here to help empower everyone in feeling their best life in this madness that we have going on. Let's do what we can do for ourselves. We can't control everything, but we can control this.
Well, thank you so much, Julie. I always look forward to your presentations, and maybe we can touch base with you in the fall again.
Sounds great. Yes, I'm sure we can come up with something. I'm sure hopefully stress will not be a topic, but I'm sure it will be. But yes, we absolutely can. And if there's any other topics that, the group has, definitely let the organizers know, and we can see. I'm pretty good at customizing several different topics in wellness. So if you have a passion on something you'd like to learn more about, let me know, or let them know, and we can get that added in.
Okay. Thank you so much, Julie, and thank you for everybody for attending. And as Marilyn said, this is our last session for up until September, and we will be in contact as we get closer to September. So thank you very much, everybody.
Have a great summer, everyone. Take care.
Thanks, Julie.
Thank you.